Biosimilar drugs are essentially copies of biologic medicines. Medicines made from living organisms, but they are not identical to the original drug. Think of them as generic versions of biologic drugs. But with a few important differences, biologic drugs are like custom-made recipes that are carefully designed using living cells, so they're really unique and complex. Biosimilars are made to be similar, but not exactly the same as the original biologic. This means they have the same intended effect, but there might be small differences in the structure or how they're made.
Here's a simple analogy. Imagine you have a special recipe for a cake. This cake is made with specific ingredients and techniques, and it turns out really well. This cake represents a biologic drug, which is made with complex ingredients and processes, usually from living organisms. Now, let's say someone else decides to make the same cake, following the recipe as closely as possible. They might not get the exact same cake because small things like the brand of flour or the temperature of the oven can affect the final result. However, the cake will still taste very similar and have the same texture and flavor. The second cake is like a biosimilar drug. It's not an exact copy, but it's very similar and works in the same way as the original cake or biologic drug. It might be slightly different, but it's still safe and effective. And it often comes at a lower price. So biosimilars are like recipes that make the same kind of cake. They deliver the same result, but are just a little bit different in the making. In short, biosimilars, similar but not identical versions of biologics, offering the same benefits at a lower price.